There's only one thing you need to know about Dr. Don Weithman. He's a small-town guy.
Yeah, it's a big deal for me to have to go to the city.
Which is why he lives in a small town and operates a busy family medical practice.
How about a fever or vomiting?
No vomit, no fever.
Your tummy been hurting at all?
Yes.
Yeah, a little bit. Where at? It's the hometown feel. You know, I grew up in a small town and there were only a couple doctors, and I kind of liked that feel. I had a small family practice doctor in my town, and he probably took care of half the population in the town, and I just always kind of liked that. I think it helps draw a community together. Big deep breath. The day you're born will take care of you and follow you all the way in.
Dr. Weithman lives and works in Naperville, just 30 miles outside of Chicago. Despite its size, Dr. Weithman's practice grapples with the same patient illnesses as any metropolitan primary care center: the flu, cancer, pneumonia, diabetes. But Dr. Weithman's greatest fear is facing the unknown.
Well, the biggest challenge is staying current with stuff that we don't see a lot of. You know, you're trained on all kinds of illnesses, and as you get out of training, out of residency in medical school, and you get more specialized, your patients, you become more familiar with them and what goes on, and once in a while somebody shows up at your door that's not normal.
And that's a situation that this former Navy submarine officer must quickly manage.
I don't like making mistakes.
To make sure he's the best doctor he can be, Dr. Weithman relies on one resource.
Most common place I go is Pri-Med. It's cost effective, it's convenient, and it's good quality training.
And then the lunch ticket is in yellow.
Pri-Med is the largest organizer of medical education conferences and activities in the U.S. Collaborating with the country's nationally renowned medical organizations, Pri-Med helps clinicians deliver superior quality patient care through a network of 100 meetings across 40 U.S. cities and on-demand access to information available at Pri-Med.com. The value to physicians is three-pronged: to provide continuing medical education, or CME, networking opportunities with faculty and peers, and information on therapies and technologies needed to help treat their patients.
When you see these folks come here and you know the kind of day-to-day challenges and pressures they deal with, which is to try to improve your family's health, that is a huge responsibility. The medical industry, from an education perspective, is obviously very mature and very capable up to medical school. But when you get out of medical school, you have 30 years of your life that you have to stay current and contemporary. And we feel like we can serve as a major component of that education for the, quote, rest of their careers. We have a unique opportunity to change healthcare in the United States and how delivery of healthcare happens through the primary care physician. It's who we are and what we stand for.
I'm usually very excited to come down here.
This year, Dr. Weithman's Pri-Med Access with the American College of Physicians Conference is in Chicago.
I don't make many trips into the city, and it takes something worthwhile to make me come down here.
On the doctor's agenda, a presentation about healthcare reform, networking with other doctors, evaluating pharmaceutical products, and a lecture about travel medicine.
We're always getting somebody in the office who's going to go to one country or another, and where do I go for my vaccines, what vaccines are really needed. And there's always new vaccines coming out, so that'll be a very interesting topic.
But something else has caught Dr. Weithman's eye: posters, big, bright posters.
So the first thing I noticed when I walked in is all these bulletin boards with all the colorful posters, so it's quite neat.
And competitive. It's ACP's Illinois Chapter Associate Poster Contest.
A lot of competition are here, and then one of them will leave this to the judge. They know who's the best.
You just pretty much summarize into the main points. And then
Meet medical residents Sui, Jose, and Cambase, all out to prove they're the poster child, you could say, of victory. It's grueling.
yeah, pulling the all-nighters, like you said, burning the midnight oil. It's part of the job description.
The patient, treated in the hospital.
So how did the contestants stack up? Dr. Mel Spiceman is a judge for a reason.
I can't really say until the end. We'll find out at the end of the day today who the winners are going to be.
Meanwhile, Dr. Weithman is on a roll, finishing up a CME session about vaccines.
I like Pri-Med mostly because of the quality of the people that they bring in. They bring in very good specialists from research institutes, cutting-edge stuff. I go to these for.
That's why Pri-Med has teamed up with this country's top medical establishments, mobilizing their leading experts to educate the 100,000 physicians who attend Pri-Med's conferences annually.
I really think that's one of the greatest things about this partnership that we have between Pri-Med and ACP. Physicians are presented with almost a glut of information these days. There's constantly new studies coming out, new practice guidelines. One of the benefits of coming to a live meeting and being able to interact not just with our faculty, but interact with your peers. We try to make sure we have that interaction between faculty members. We try to keep things moving quickly. We try to keep it entertaining.
Dr. Joseph Legaspi, an internist in Indiana, attends Pri-Med every year.
My concerns is obviously resources as far as how to take care of my patients. A big piece is obviously the burden of trying to see more patients in a shorter amount of time and being able to cope with making sure each one's tucked in, and that's where I try to see if I had come up with more ideas, going to conferences here, seeing really what am I doing right, what am I doing wrong, see how my track record is, and try to pick up a couple of new tricks, to help me out. The way the format is, where there's a question and answer, it's dynamic. This is actually interactive. There's tremendous things to learn.
And in between the many presentations, Pri-Med offers another sort of learning. Doctors meeting other doctors.
You share experiences, and that enriches you, basically. See where you're at, and see what things you could accomplish down the road, for yourself.
And down the hall, Dr. Weithman just walked out of his third presentation, this one an industry-sponsored non-CME session in the Product Theater about insulin therapy. These presentations are completely separate and available only on an opt-in basis from the CME curriculum offered at the event.
It was very good. I see a lot of patients with diabetes in our practice, and in this case it was a full line of different insulin regimens and different opportunities to use what kind of insulins. Very well presented and well worthwhile to take back to our practice.
We talked about optimizing insulin therapy, trying to get our patients to target, understanding the guidelines. I try to give them a disease state model, talk about the drug itself, give safety and side effect issues with it, and then engage questions. A lot of people have questions about it, so I think this program is very good in teaching physicians and healthcare professionals how to initiate, how to up-titrate, how to reach their targets.
And then you can just rest your heel in the back.
Physicians also have the opportunity to seek out trained company representatives about the medicines and technology they provide in the product forum.
When you're in the office with the docs, they have all the external pressures. It's really hard to get some good quality face time with them. And here they're relaxed, they're interested, they're ready to talk, they're asking great questions.
We only have time about 3 times a week over lunch, and otherwise they just have a couple of minutes at the door to say, hey, this is new. You don't really get enough time to sit down with them. This helps out quite a bit. I can sit and spend as much time as I want talking to people and asking them questions.
They want to be able to engage with the pharmaceutical industry on their terms. They don't want to have a situation where they're competing with patient care to get the critical new information they need.
Breakthrough clinical insights, medical technology, A-lister experts, and partnerships with the country's leading medical institutions. The message is clear. Pri-Med is dedicated to excellence for doctors, for patients, for the future.
I love what I do. I love taking care of patients. It's an honor to be their physician.
And whether it's a bustling practice in a major city hospital or a tiny practice in the country, Pri-Med gives doctors the confidence and training to treat every patient with the most superior care available today.
Open real wide. It's rewarding for me to be able to help people and participate in their lives. Make sure you get plenty of rest, stay home from school the next couple of days. Best job I've ever had. I care very much about doing it well. Love it.